Hello everyone, my name is Dr. Divan. Welcome to sqadia.com. The topic of the lecture today is Pathology of Neoplasia. In this topic, we're going to talk about how do we approach the neoplasias in regards of the pathology. First of all, we're going to talk about neoplasia, what neoplasia stands for, what's the meaning of the name neoplasia is. Neoplasia stands for new growth. We're going to talk about which kind of new growth are we talking about. We're going to differentiate neoplasia from hyperplasia and how they're not the same. When the tissue growth is happening in both of them, cells are dividing at a very rapid stage in both of them. How do we differentiate them? What are the differences between them? And how is neoplasia irreversible and hyperplasia is reversible? Next on, we're going to talk about benign versus malignant tumors. We're going to talk about what benign tumors stand for. We're going to talk about what malignant tumors stand for. We're going to talk about their structural differences, their functional differences, their effects on the neighboring organs, and whether they metastasize or not. And recurrence options will also be discussed in benign versus malignant section. Then we're going to talk about the classification of the tumors. Then we're going to talk about how do we classify the neoplasias? How do we classify the neoplasias on the basis of their origin? Whether they're epithelioid, whether they're mesothelioid, whether they're benign, then we started with a different name but ended with oma always. Whether it's a malignant tumor, so we ended with sarcoma always. To give us an idea of whether we're talking about benign tumor or malignant tumors. Next time, we're going to talk about histological diagnosis of malignancy. We'll talk about at the histological side, how will we know that metastasis has already happened? How will we know that it's invasion stage? How will we know if it's lymphatic metastasis stage? How will we know that hematogenous spread has happened or not? We're going to talk about all those depiction of slides at the histological level, that whether the malignancy has started or not. Next time, we're going to talk about marker studies. We're going to talk about which markers are for which organs. We're going to talk about whether if CEA is present and what other marker is present, then we decide that it's what tumor. We're going to talk about all those markers. You have to memorize them in order to diagnose the patient very thoroughly. Then we're going to talk about invasion and metastasis, that how the cancer gets to the blood and then it goes from there to different organs and affects the higher mental function, affects the other organs, and how it reaches up to that level that there is no going back. Next, I'm going to talk about staging and grading. We're going to talk about T&M staging. What does it stand for? How do we differentiate and how do we stage and grade the cancer? Then we're going to talk about grading, that is G1, G0, G1, G2, G3, G4, and specifically GX, in which we don't even know what the stage of the cancer is, what the grade of the cancer is. For watching the complete video and other variety of lectures, please subscribe to sqadia.com. Thank you for watching.